Hi there, and welcome to today's edition of A Different Way of Seeing, a podcast where we talk all things disability. I'm your host, Lois. And today we are going to be exploring an organization that is a real tool and a resource for people from the low vision and blind community. The Low Vision DRAT.
Center of Learning.
Center of Learning. Okay, so take two. Hi there, and welcome to today's edition of A Different Way of Seeing, a podcast where we talk all things disability. I'm your host, Lois. Today, we are going to be talking or exploring an organization that is a very valuable tool for members of the low vision and blind community, the Low Vision Center of Learning. And we have three guests today who are joining us from that organization. Ladies, welcome to the show. It's great to have you with us.
Thank you.
Just as a start, if I could please ask you to just give us a quick introduction to yourself and a little bit of your backgrounds so that my viewers and my listeners know who it is that we're chatting with.
Okay. I'm Belinda Leibowitz. I'm an occupational therapist, and I work in the Low Vision Center of Learning as well as privately in practice.
Welcome, Belinda.
Thank you.
Hi, my name is Denton. I have a strong background in education with a particular focus, in fact, on diabetes, which for nearly 30 years, I traveled internationally to lecture, present at conferences, to chair and attend diabetes-related meetings. Given that eye damage is one of the most serious complications of diabetes, transitioning into the field of eye care alongside Hazel and Belinda was a natural progression when I returned to South Africa.
Well, Karen, it's great.
I'm Hazel Sacharowitz. I'm the third member of the team. Belinda, Karen, and I have known each other for many, many years. My background is in optometry. I have a special interest in the field of working with the visually impaired. I was in academia for nearly 25 years, after which I started in private practice and then joined with my colleagues Belinda and Karen to start this Low Vision Center of Learning to share our knowledge and expertise in the field.
It's wonderful to have you all with us. Thank you. So what I find really interesting for me is, as a blind woman whose blindness is caused by diabetes and who has an interest in empowering others who are living not just with blindness and low vision, but with all disabilities, it seems like there's a huge intersection between the work that you're doing and where I am sitting in my space. So I'm really fascinated to learn more about what you're doing and the organization and to share that with my communities. So thank you for being part of this call. Even with what you've explained so far as to how you arrived where you are in the Low Vision Center of Learning, what began your interest in the BVI, the blindness or visually impaired community?
Okay. So for me, I had left occupational therapy, and a chance request by a friend to help out at Civilian Blind. But this request led me to attending the first Low Vision conference in 1987, where I met Hazel. Hazel gave me an eye chart and some guidelines for assisting patients. And this resulted in me taking my patients from the Civilian Blind to what was then called RAU, to the Department of Optometry. And this opened up a whole new world for me, and I discovered my niche in occupational therapy. This was the start of my journey working with Hazel in a multi-disciplinary approach and an interest to teaching people that there is life beyond visual impairment.
Thank you for sharing that. So from there, let's look more specifically at the Low Vision Center of Learning. How did it begin, and what is it, and what does it aim to achieve?
I'm going to answer that kind of in a circular way, if that's all right.
Sure.
Our goal, both when we started and now, has and always has been to create a multi-disciplinary hub that serves as a gateway for people, particularly in South Africa, but also globally, to learn, share, connect, and access a wide range of all kinds of valuable information related to this community. We achieve this by applying the principles of ERIC, which stands for Education, Resources, Information, and Courses. Our mission is very, very clear. When we started the Low Vision Center of Learning in 2018, the three of us got together, and because we represent professions from different areas, as we've said, optometry, Hazel, occupational therapy, Belinda, and education, myself, we felt that we could blend this into a valuable tool to reach out and to provide comprehensive education, resources, information, and courses, as we said, to support both professionals and individuals affected by low vision. In other words, anyone who has anything to do with low vision or blindness in this country, we are the go-to people. In essence, we then established the Low Vision Center of Learning to address what we regarded as a very fragmented nature of the low vision services in South Africa, and to unite people at all levels. Our aim is to continue providing a centralized, accessible platform to enhance awareness, to educate the public and professionals about the complexities, anything that there is to know and anything that is new and updated about low vision, to promote collaboration, as we said, to foster partnerships among the various disciplines, because we know that that is an essential to good care. Also to empower each and every individual out there who has low vision. In this way, we provide resources that enable those with visual impairment to lead independent and very full lives, and to reach everyone, everywhere, at every level, in every sector of society who has low vision. So we do this, to answer the beginning part of the question, by providing our very, very popular educational webinars. These are regular sessions, and we have a variety of topics. Our speakers are sourced from around the world, and we have completed more than, you were saying 120?
Well, we've got 129 on the recorded webinars on our website.
Plus a few that we didn't record. And those recordings are available on our website. We also do accredited continuing professional development within these, where people get their CPD points as needed. We also are developing a whole series of courses, which will also be CPD accredited. And as soon as they're ready, they'll be on our website as well, with the University of Alabama. And that series of conferences is the Low Vision Matters conferences. And in that, we again focus on interdisciplinary collaboration, updated info, and practical applications. We have our workshops. These are very exciting one-day workshops, and they are also CPD accredited with hands-on, interactive, fun, interesting ways to explore everything that happens in the eye. People really enjoy those and in fact, very often at the end of the day, people say, oh, isn't there more? And then, of course, we are a resource hub, as we said. Our website has everything you ever wanted to know about low vision, where to find it, etc., service providers, assistive devices, support networks. And then, last but not least, we have our WhatsApp groups. And these WhatsApp groups are incredibly dynamic, where people share information, ask for answers, get their answers, and check where and how resources are available for them. In other words, just to summarize everything, the Low Vision Centre of Learning tries to bridge a gap in knowledge and services, ensuring that professionals and individuals work together to access the latest information and to support every possible aspect there is in the field of low vision. Thank you.
Thanks,
That was
Karen.
quite
There's a lot of information in there. Thank you so much for such a concise summary. That was really fantastic. You know, I think for me, in talking to people from within the disability community, I so often am facing the awareness that often people don't know where to turn and to find information, to find who they need to speak to. You know, it kind of goes back to that old saying that it's not what you know, it's who you know, who knows what you need to know. And, you know, I think having something like the Low Vision Centre of Learning is such a valuable resource because of the various components and also the various platforms that you're using to share and disseminate the information. I think it's really such a valuable platform and yeah, a resource that can be of extreme importance, particularly, well, to both people who are newly into the community and people who've been working within and around the community for some time. So let's try and look a little bit more specifically from who it is that you feel can benefit from the work that you're doing. Who should be connected with your organization?
So we aim to actually reach out to anybody. You know, it's the idea, as you said, was it is so difficult to know where to go to. And low vision and visual impairment has been around for so many years. And when B and I started way back, one of the things we found was that there was no interaction between even medical people, even in the profession. You know, you go to one doctor and they don't even tell you there is some kind of organization, whether it be something like a Retina South Africa or professionals, private professionals, they just say, sorry, I can't do anything about it.
Yeah.
And over the many years, we always chatted and said, can't we put together something? We've got this knowledge. We've built up contacts in the different fields across, for example, mobility and orientation. You've got your medical doctors, you've got your optometrists, you've got your OTs. There's so many people in so many different disciplines, and nobody is talking to each other. Nobody's taking hands. And that was one of the real important aspects that we decided on when we got together to establish this Low Vision Centre of Learning. So it was not only to educate, but to be able to share information across the different disciplines and even to the private public, because people today with social media are empowered themselves to be able to go and look on the internet. And most of us are doing this. I know it's not always such a good thing, but sometimes too much information is a little bit dangerous. But at least if you can try and find something there and that would get you in the right direction. So that's how we established this Low Vision Centre of Learning. It is based on a website. I don't know if I can share that right now.
Absolutely.
Can tell people, okay, so it's on www, let's start that again, www.LVCol, so Low Vision Centre of Learning, LVCol.org.
Thank you for sharing
So we
that.
hope that, you know, people go and look there. And as Karen said, we based it on ERIC, which is our education, our resources, information, and courses. All of that is readily and easily available on the website.
Thank you. And thank you for sharing the website address. We will ask for just those to be repeated towards the end of the episode as well. But, I think one of the things that I hear most often when talking to people who are blind and visually impaired, well, people across the disability spectrum, in fact, is that when they receive their diagnosis, so often their doctors say to them, well, there's nothing more that we can do. You're on your own now. And it leaves people feeling incredibly isolated and incredibly overwhelmed. So that need for a multidisciplinary approach to bring everybody, all the stakeholders together to be in one space, I just cannot underestimate or undervalue that resource. So you mentioned the webinars and the courses that are going to be available. Can you share a bit about some of the events that you have held so far? And just let us know the types of things that people will gain from enacting.
They certainly are. And I'll kick off and then we can hand over to Belinda as well. We have regular meetings in Gauteng at Belinda's home, in fact. And I know that when Belinda visits other centers, she creates these meetings there as well. And hopefully they also continue. We try to limit the number to about 20 people attending. And the reason for that is so that people can relax, interact, have a meal, be part of a group, share with each other, learn from each other, and above all, inspire each other. And it's amazing how many people use those words when they leave and say, I arrived feeling so down and I'm leaving feeling so inspired. And I will share with you that one of the attendees' wife actually contacted us and said, thank you. You've given back my husband's shots. Sorry, that's my cat. You've given back my husband his life, and you've given back my husband to me. And I think that the group then obviously is incredibly popular and is attended by visually impaired people, but also by people from various organizations, because we try to bring the different organizations together. And that really is very exciting. We also mentioned, or I mentioned earlier, that we have the one-day very popular workshops. They're very different, as I said, very unique, very interactive, and great fun. We work in small groups of between 3 to 5 people, each with a group leader. And just a couple of examples. We start with a model of the eye that people unpack, take apart, put together. We shine a torch in so that they can see exactly where the light falls on the retina and why in certain conditions this is what happens and in other conditions that is what happens. And people really grasp what vision is about after they've been through that. We then progress to a very lively detective story that starts off with Detective Nomza is summoned to a retirement village where she has been asked to investigate the mysterious case of a woman who can no longer recognize faces and is bumping into things. And then they have to work right through that. And it becomes more complicated as they come along. But the fun and interaction as they go through. And then a whole lot of activities, including we also construct DNA. We put DNA together. And the reason for that is to give people a basic understanding of genetics. And we then let them do a genetic intervention so to understand how the current genetic interventions that are so really catching on in so many conditions are being applied. So people leave inspired. They learn about assistive devices, all kinds of it. Everything is hands-on, different, and exciting. So, B, I'm sure you've got more to say.
So one of the things that I found when I got into this field 37 years ago was that they'd already started CPD But there wasn't really much available for me in the field of visual impairment, not because it wasn't available, but I didn't know where to find it. And so I attended the courses, the optometric courses with Hazel, and went to ophthalmological talks. And it was a case of there was so much available, but people didn't know about it. And exactly to your point of that, when people say there's nothing more I can do, the bit that is missing is who to refer to. And so what we've looked at doing is a bottom-up and a top-down approach, so that if the patient knows more, they can try and find people who can provide the service. And as an OT, so much of our work is based in vision. Well, so much of life is based in vision, that how can we teach people to use their remaining vision? And looking that in terms of the work that Hazel does, that a low vision assessment is very different to your normal assessment. And somebody said to me this week, but why doesn't everybody do that? And I said, well, I'm an occupational therapist, but there are 15 at least special fields of interest. So if I know about it, I will pick up an area of concern and say, I'm going to refer you to an occupational therapist who has a special interest in. Yeah. And so what we would love to happen is that we would love the moment that patients are diagnosed with a pathology, that they are referred to an OT, to a low vision optometrist, to an O&M. Often patients say, I'm not ready to walk with a cane. You don't need to start at walking with a cane. You need to start with learning how to orientate yourself in unfamiliar places. You need to, at a conference, one of our guests said that she had the opportunity to have all the bells and whistles when she lost her vision, but she'd been thinking that morning what had given her the most independence, and it was her cane. Mm-hmm. And I think that when people hear that and learn that and stop seeing it as I am now admitting that I'm blind, you are not. You are learning that a cane becomes your biggest friend in unknown spaces. Okay.
It's one of those things, in fact, I've come very much to the realization that everyone's journey is different. And for each of us, you know, the tools that we find that add the most value differ widely. So for me, a cane is not my most valuable resource. For various reasons, I am not an effective cane user, but I do understand the value that a cane and the information that a cane can offer. But I think just going back to that, you know, the acceptance of using assistive technology, that is a very big step in itself for many people. And
can I just add something there? Very often a patient will say, well, I've just accepted that this is my lot in life. And there's a very big difference between acceptance and resignation. I've accepted my loss in life is resignation. Yeah. Acceptance is I have a disability, whatever it is, but I have found ways to cope with it.
Yeah. You know, for myself, just on a personal level, I have a very strong belief that, yes, I use different tools and techniques to accomplish tasks, but different only means different. It does not mean inferior. And you know, I think that one of the frustrations that I find is the generally accepted or generally held belief that without eyesight, that it is that you are less able to interpret the world around you. And I simply do not accept that. It is just a different way of doing things.
Absolutely.
But yeah, I mean, it's a journey that each person takes at their own time, their own speed, their own pathway, and to a different level, I guess. So yeah, working in such a complex space is quite a, there are so many different aspects to take into consideration. And thank you for being so broad-minded and kind of inclusive in the way that you approach the work you're doing. So I suppose...
Sorry, Lois, can I just quickly add a little bit in there?
Please
I think it's
do.
also important to know that vision is not something that is stable. Unfortunately, when we do get vision loss, it's not something that generally remains at one level. It's something that's progressive. And as you mentioned, not everybody is the same. What is good for one person at one situation is not the same for somebody else. And knowing that there can be a progression often causes lots of other aspects. At some stage, you find you're coping with your vision loss. Things are going well. Next minute, you find that you're not coping. So it's a journey. It's a long journey. And we want to be able to try and stand by someone that has this vision loss and be there for them. Just this week, in fact, I've had a patient of mine that's been with me for many, many years. I'm not even going to say, but he's now at the stage where he needed to get a guide dog. So I have been there all along. At that stage, he was not ready, whether it be ready for a cane or ready for a guide dog. He's now at that stage, and he brought in his little dog for me to see. And it was so special, and he just came to thank me. But, I was not, that was not part of my journey, it's part of his journey, but I was able to be there to that stage that he came to share with us. So I think that is something just to be aware of, that you can't get everything all at once in the beginning. It's a slow journey, and what is right for one is not always the same for the next. And when you're ready, you will take the next step. So we're here to try and be there to guide people along the way.
And to provide the information and the education about the tools and resources and options that are available. So that's a message that's coming through very strongly as we're talking. So where can people find the Low Vision Centre of Learning? What are the different platforms that we can access to make contact?
So we're not based in a house or a home or an office. We are all sort of web-based. It is only accessible really through the Low Vision Centre of Learning website. And Belinda also runs a whole lot of WhatsApp groups. Perhaps you want to just elaborate a little bit on the WhatsApp groups, Bea?
Okay. So many years ago, we had a patient who was a social worker, and she said to me, "Why don't I run groups?" And I said, that wasn't really my thing at the time. However, in 2017, at one of our talks, a young girl said to me, "It's so difficult to meet people when you arrive in a town as a visually impaired person." And I said to her, "You know what? People have always asked me about groups. You're going to be the first person on it. We're starting a group for professionals who are visually impaired." And for me, that means anybody who earns a living. I'm not talking about being a lawyer or a doctor. I'm talking about someone who either was in a profession or a paid job and then lost their vision, or was visually impaired from a young age, and they then started their journey. So on that group, we currently have about 250 people, and it's a very good resource for people to go on and often just sit on the sidelines and get very good information on apps, on where to find things, very good suggestions. And then we have another group, which is for people working with the visually impaired. And that is doctors, OTs, optoms, ophthalmologists, anybody who has a patient who's visually impaired. So if you are a physio and you are working with a visually impaired, it's knowing who you can refer that patient to, or learning some ideas about understanding why certain things are difficult for your patient or how you can help them. And on that group, we have about 600 people. So just to go back to where this all started, it started in 2016 when a visiting optometrist gave us a lecture, and there were 12 of us in that room. And it was so exciting chatting together again, because once Hazel and I had left the university, we weren't in contact with all those people. And we said, can we try and do this more often? And that started our monthly meetings, which since COVID evolved into that we've had, as Karen said, over 130 webinars. And it has spread across the world. We now have about 4,000 people around the world on our database. We have had people from 65 countries and 361 cities attend our webinars. So this has really been global. And what we do with the WhatsApp, if somebody wants to join, I will actually chat to them and explain the role of the WhatsApp group, so that you don't just join and see all these things. It's how can you access information? Or somebody will phone and say, I just saw a patient. Can you give me some advice? So what we really want to do, and the hope with the Low Vision Center of Learning, is to leave a legacy. We will still be involved for years to come, but to leave something where we have this legacy that the younger people will get involved in. And for OTs to realize, in fact, 2 years ago, low vision for OTs was accepted as a special field of interest. So that is a totally different field to go in. Okay, so I'm not sure if that answered, but it's really trying to get all the information out.
So I suppose I've got a couple of questions that and then we'll get down some of the specifics. But how do you reach out to the people? I mean, I find that within the visually impaired community, often people are connected with other people who
Yes.
also live with visual impairment. So that makes sense to me, that the word spreads and people then reach out. But in terms of the medical professionals, how are you accessing, reaching out to include people who have a special interest in this area to bring them into your network?
By word of mouth.
Very much
So
word
it's
of
very
mouth.
Yes. And at conferences, at meetings, and we will tell one ophthalmologist, for example, and they will spread the word to someone else, and so on and so on. Yes, as B says, it's word of mouth.
Great.
And conferences, there are optometry conferences, OT conferences, ophthalmology conferences, O&M conferences, and we always try to be, visible.
Great, thank you. So if someone were wanting to reach out and engage with your group, You have given us the website address, but can we just repeat that? And then how would people then reach out to become part of the WhatsApp groups? So let's start with the website. Could we get that web address, please?
The website address is www.lvcol.org. It's the initials of Low Vision Center of Learning, lvcol.org. There is a little chat on the website as well, if you are not accessible. And in actual fact, if you go onto the website, we maybe haven't really spoken about it, but it was designed with visual impairment in sight. Excuse the pun, but so everything is nice and big and bold and bright and large. Our first, as you click onto the site, is a big E for education, the R for resource, the I for information. It is very clear, it is very bold, it is quite accessible. So I think that is really a starting point. And I think there is an information button. Am I right? Just to check B to get to the WhatsApp. If they send us a message from there, we do get an email which we can respond to.
Yes.
Most people, I'm not sure if they can't access the WhatsApp unless they go through us. B, how do we get onto the
Yeah.
WhatsApp?
So in terms of getting on the WhatsApp group, somebody will email, or even when we do the surveys, and people will say, well, will you let me know about other talks that you have? When we go through the surveys, we will actually look at comments and contact people. We also have many patients or visually impaired people, and a lot of people call them clients, that people who attend the webinars themselves because they want to understand more about their pathology. And although they are geared to people working with the visually impaired, many of our visually impaired have found a really good understanding about their pathology. Okay.
Great, thank you. So if someone were wanting to reach out to you from listening to this, they should go onto the website and they will be able to contact you through there. Do you have a
Yes.
presence on any of the social media platforms?
Yes, we do. We're on Facebook. So there's the Low Vision Care Centre website, which is the Hazel's practice, where we link a lot of the stuff and make that information available as well. We have the Low Vision Centre of Learning website, Facebook page. And then we also have two groups, a South African, a group for people who are visually impaired and a group for people who work with the visually impaired. Okay. And
YouTube, are you present there?
So we are not, but our webinars are recorded. And if you watch our webinars, you can subscribe to our webinars on YouTube, and then you will know when the next recording is available. But we don't do it. It's not it's unlisted on YouTube.
Great, thank you.
Okay.
So then, as a final question, what does the future hold for the Low Vision Centre of Learning, short term, mid-term, long term, whichever? I would be curious.
So let me take that one a little bit. If we look at the short term, what we haven't actually mentioned, and perhaps you can tell your listeners a little bit about it, we are in the throes of planning this year's conference, which is going to be the 18th to the 20th of August in Johannesburg. We are privileged to have two overseas speakers coming from the University of Alabama in America. They did present last year and they are coming back again this year. And guess what? We've been told they might even come back next year. So the conference is open to anyone, well, all professionals in the field of visual impairment. We had a real mix last year, OTs, teachers, nurses, optometrists. Sorry, who I left out?
O&Ms.
O&Ms, etc., etc. A whole group of
etc.
people. So it's really, and they network. What is so great about that is not only the information that you learn, but the networking between the professions, people that can support you going forward. So that is in our very short term. We are looking very forward to that. Midterm, we hope to continue with our webinars and our WhatsApp groups. We've got lots and lots of webinars, beautiful, amazing speakers, national and international, that Belinda manages to source. I'm not sure from where, but she pulls them out of a hat, and each one is better than the next. So we look forward to our continued webinars to share that information. And what was the other one?
And our one-day one-day workshops that I'll be doing in Cape Town in September.
Oh,
Fabulous.
fantastic.
Karen does an amazing job with those one day. Something new that we've just introduced this year, and it has taken off so, so well. People are loving it. It's one day, it's short, but it is so informative, and they walk away with so much knowledge. So thanks, Kay, for all the effort that you put into that. You know, I think what is so nice is
And
three
but we
different
do-
people. Yes. Sorry, I'm just going to quickly say we're three different people from
Sorry,
three different
I
backgrounds.
was just interjecting there. Yes.
Okay, say there's three different people from three different
Is that a-
backgrounds. Oops. Okay, Kay, over to you.
Sorry, I was just going to say that we do tailor the presentations to our audience. And for example, if we have optometrists, we're not going to sit there and teach them about the eye and where light rays go. You know, they know that. That would be insulting. So from that point of view, we go through, if we have optometrists, the misunderstandings that have arisen with patients when what they've heard and what they think or what they've understood from their neighbor that is completely incorrect about the eye. And some people, one person told me recently, I won't say where she's from in case she listens, but she told me recently that her optometrist had just done a lens transplant for her. And I said, "Oh, really? Your optometrist?" She said, "Yes." And she gave me a box to put them in. So she obviously thought that she'd had a lens implant that she called a transplant,
Yes.
whereas obviously it was contact lenses. So people just misunderstand so much. And I think we must encourage people also, if they don't quite understand, to clarify that they go away with a clear understanding of what whichever professional it is has just told them.
Agreed. Yeah.
Sorry, Hazel. I just had to
No
interject.
problem. No, it's fine. No, it was excellent. So, you know, we hope that we've made a mark in the world of visual impairment, and we hope that it is something that's going to leave a legacy that is going to be ongoing and will be available. If not through us, we want to leave it on to somebody else that can continue with this journey and share in the information.
Well, thank you
Can
so
I just
much.
add?
Yes,
Can I
Belinda,
just
please.
add a point to what Hazel said there? There are many people working in the field of visual impairment. People who have developed things, people who are visually impaired themselves, who are developing things that we would like to somehow provide a platform for, that they can talk about what they've developed and extending the knowledge. It's really a case of grouping it. The concern about the website, because there is so much information, is how to actually have it in a logical sequence. But if your listeners can actually just realize that there is so much help available, And for us, it's with the WhatsApps, we've also created WhatsApps of people in particular areas. So in Cape Town, in KZN, we've created a group for professionals in that area. So what will happen now is that in the good old days, we'd go, you'd look at your Rolodex and the information was outdated. Now people will post, I have a patient that is asking about whatever, and you're asking it to 600 people. Someone will give you an answer, either by replying privately or putting the information on the group. And so with WhatsApps, you can star that information, or you can build up your own resource list. And yeah.
You know, as a coach and a facilitator, which is part of the work that I do, I understand the value of the community being
Yes.
able to share knowledge and share information. And I think the biggest danger well, no, but one of the dangers that we face as a largely marginalized community is the isolation, and being able to have a community space that one feels not only heard but understood, and unafraid to ask the questions that really help us to move forwards. It really is just amazing.
So on that note, one of the things that I really am keen to help people get more involved in is the disability inclusion, that it's not window dressing, that somebody who has worked in a company for 10, 15, 20 years, that with the right accessibility tools, they can continue to make a difference. They can continue to be taxpayers, and they can continue to play a very valuable role, because one must remember that disability is a club you can be invited to at any time in your life.
Yeah, absolutely. And I think, at a risk of allowing myself to jump down into an entirely different conversation, there is so much just there in that space that I think needs to change, because the number of people who are unnecessarily medically boarded because people simply do not understand what is available to those of us living with disabilities.
Absolutely.
It's yeah. Anyway, thank you so much for sharing information about the Low Vision Center of Learning today. Belinda, Hazel, Karen, you've given us a wealth of information, and continue to give members in our community and those working with our community incredible tools and resources. So thank you for the work that you are doing, and thank you for sharing a little bit about it on A Different Way of Seeing today.
Thank you so much.
Thank you for inviting us. Thank you.
Thank you.